My name is Dr. Eric Kasowski, E-R-I-C-K-A-S-O-W-S-K-I, and I'm the Centers for Disease Control and Prevention team lead here for the quarantine in Omaha.
Dr. Kasowski, are there any passengers here right now, or are they all gone?
We're not talking about movement today. Passengers, the really important thing to know is that 57 people arrived here for quarantine, and 57 healthy people are going back to their communities. And the really important thing to know is that these people pose no health threat to their communities. These Americans have done their duty 14 days, and they're getting to go back to their families.
Talk a little bit, what is it like for them now? What are they telling you? What's their response now that they can leave?
Oh, they were just grateful. This was a fabulous group. They were happy and grateful the entire time, and really thankful, certainly, to be here in the United States. They understood the reason for the quarantine, and they were real patient with it. So it was really a terrific experience, I think, for us. I would say. I don't want to speak for them, but certainly for the CDC team, we felt like we bonded a little bit with the group, and so they were really definitely happy to leave, though.
We're obviously seeing that all quarantines are not created equal across the world. Talk about just the setup here and making sure everything was right, and the process that you guys have now obviously been able to work through, so that if there's another quarantine, you guys are ready for that as well.
Yeah, so I attribute the success of this quarantine to the partnerships here. First of all, the Nebraska National Guard was just an amazing host for us. Anything we wanted, they provided, and so really hats off to them. The state and local health departments that we partnered with are fabulous. Nebraskans ought to be really proud of the state and local infrastructure here. All the other partners that helped in this. I think that's what is most responsible for the success of this. We got in a rhythm. The CDC team got in a rhythm. We were out here doing health checks every day. We were looking at people every day. We were looking at infection control issues every day, but our job was made easier by all the partners. University of Nebraska Medical Center, don't want to forget them. So it was really nice to see a federal response like this come together so seamlessly, but it's all because of the partners.
I understand there's going to be a final screening process. Can you talk to us about what that looks like today? Yeah,
so the final screening process is the same as the daily screening process. It's just a final temperature check and health check, and everybody's screened healthy, and so they're all cleared to go. And like I mentioned before, these folks pose no health threat to the communities that they're returning to.
Can you talk to us about the 13 others who are at the medical center?
I can say that we're watching them very closely. Many of the same procedures that occurred here, but really today we're just laser-like focused on getting these folks repatriated back to their communities and families.
Is there any plan for an update on their results on the 13? Any idea when that might come through from the CDC?
I can't talk about it right now.
Are there any plans to use Camp Ashland in the future for more evacuees, or?
I wouldn't be the one to ask about that. I don't know. CDC didn't make the decision to come to Camp Ashland. I just feel very fortunate that we were here, because Camp Ashland was just fabulous.
Do we know when the flights are leaving?
They're all different times throughout the day today.
And then who pays for those?
Let me think. The passengers, yeah. Yeah, the travelers are paying.
I don't know if you'd be able to answer this, but I've talked to some people that are in quarantine. We're in quarantine here at Camp Ashland, and then some of the people who got off the cruise ship, the 13 that are now at UNMC, and it sounds like the people here at Camp Ashland had to pay about $1,000 to be evacuated from China. However, the ones from the cruise ship didn't have to pay for that.
I don't know the particulars on that. I think. Yeah, so I'm not quite sure who paid.
Can you tell us a little bit more about what the health checks look like? Was it literally just like a temperature check, or?
Just a temperature check, and and just asking what their temperature recording was from the night before, and just a general health check. How are you feeling? Do you have a cough? Any difficulty breathing? I got to say, this group of 57, they were healthy on the when they came in, and they're healthy on their way out today.
Once they leave, will there be any sort of follow-up?
No, their quarantine is officially rescinded, and so they're done.
How are you guys able to be so confident that you know they don't have anything?
We feel comfortable that the 14 days is well outside the average incubation period. So we think the incubation period is somewhere around 5 to 6 days. So we're clearly 2 incubation periods beyond that, and that's generally the benchmark that we use.
The
There was a
CDC
group-
said that they'd be doing a cleanup after they leave. Can you describe what does that cleanup look like?
Actually, yeah, right. It's what we're doing is are sanitizing all the rooms in accordance with federal guidelines, and I think actually the UNMC crew, they're going to run UV lights through just to be extra cautious. I got to be honest with you though, I would have absolutely no reservation putting my family in any of these rooms right now.
Is Camp Ashland prepared to receive more guests?
I don't know. I'd have to refer you to them, ma'am.
Any things people have told you they're particularly looking forward to about leaving the quarantine?
They're looking forward to certainly getting home to their families first of all, and then some folks said the food. They're looking forward to being able to cook for themselves again.
You said the CDC didn't decide on Camp Ashland. Was it Asper?
Not quite sure. I think it was an interagency process that they went through to find sites. Asper was certainly involved. DOD certainly at the highest levels, Department of State, I think, but I don't know. I'm not really privy to the actual process.
So multiple agencies might have came together and said.
Oh, definitely. This has been a multiple agency event right from the start. Okay. Anything else? I mean, I think.
Sorry.
Go ahead.
What do you want people to know? I mean, moving forward, I mean, obviously we have 57 people that are leaving here, but we still have 13 people at UNMC. A lot of people, I mean, I know the message is that Nebraska is equipped, UNMC is equipped,
Yep.
but a lot of people are still wondering, why us?
Why us? I can't answer that. I'm just grateful that it is us here in Nebraska. I mean,